The Random Moment Time Study. What is it and why does it matter? Your school district participates in the Random Moment Time Study, or RMTS, as part of the School Health Services Program. This program provides additional funding for health services for all students. The time study measures the amount of time, statewide in Colorado, spent delivering health-related services to students with IEPs.
By completing this survey, you're helping to bring in more money, more resources for kids.
The RMTS survey is assigned randomly, which means you may be surveyed multiple times or not at all. You will receive a notification email 1 week in advance of your moment. Do not modify your activities in advance of an assigned moment. Be accurate and clear in your response, and include any health-related IEP or educational details relevant to the situation. You will have a limited amount of time to respond to 5 questions. It is very important to respond briefly, but with enough detail to fully explain the activity you were performing during the moment. The survey contains 2 open-ended questions, asking you to describe, in a detailed manner, what you were doing during this moment in time, and if you were providing direct services to a student. The intent of this video is to show some examples of health-related services in the school environment. Some situations may present characteristics of both health and educational services. We understand that it can be difficult at times to see all aspects of health-related direct services, and we hope to provide examples that show how certain services that may be educational might also have health-related aspects. In this activity, the student uses his hands and a tool to make different shapes with Play-Doh. A service provider assists the student. The Play-Doh activity is a way to address fine motor, visual motor, hand strengthening, and bilateral coordination skills.
Blue. Show me blue.
In this activity, basic core vocabulary concepts are being targeted, as well as vocabulary familiarization with the designated communication device. Additional health-related services may also be addressed, such as hand-over-hand assistance and safety monitoring due to the student's disability, and as indicated in their IEP.
Can you make this?
In this activity, the students use shaving cream spread on the table in front of them to draw shapes and letters with their fingers. Cards with images are used as examples for the students to draw. The shaving cream activity is used to address sensory processing and fine motor skills. This scene shows a student working on motor skill development, including holding objects, finger strength development, and hand-eye coordination. The activity also allows the student to develop life skills.
Tell me with the talker.
In this scene, a therapist works with a group of students, using a communication device to address sequencing specific icons, sentence development, device navigation, and purposeful communication.
Good job. You want to play?
Basic core vocabulary concepts are being targeted, as well as vocabulary familiarization with the communication device. This activity also encourages turn-taking and facilitated socialization. This scene depicts a teacher's aide in a meeting with a speech-language therapist, discussing the educational progress and goals of students. This may be a consultation or IEP review, including both educational lesson plans and the healthcare needs of a student, such as specific articulation problems or pronunciation. Your involvement in the RMTS is vital to ensuring resources continue to be available for students. Health services in schools are essential because healthy children do better in the classroom.
We're passionate about helping children learn, be more successful, to have all the same chances in life as everybody else. When you see the difference it makes for kids, you just want to help school districts do better and better because it's how important it is to the most important people, and that's the children.
Under the School Health Service Program, school districts have expanded and enhanced health services, including increasing the number of school nurses. The nurse-to-student ratio has improved. Students now have greater access to a school nurse to help manage chronic and acute health conditions. Emergency medication vouchers and outreach services. Uninsured students are able to receive a 1-month supply of medication. Additionally, an outreach team follows up with the family to help them apply for health insurance. Hearing and vision screening equipment. Early childhood screening ensures that any deficits are identified and addressed early on, which reduces the impact on a student's ability to learn. Thank you. You make a difference and help to ensure children in Colorado have the health services they need to be successful in school and life.